Dear colleagues, an interesting analysis awaits us today. We will analyze the case with the septa, which we saw on the X-ray. Now I will draw the situation that we're getting. Let me remind you that we have 2 millimeters, which is not so much, and here respectively is also 2 millimeters. And here is also a root filling material. You should have seen it on an X-ray. Our goal here is to install an implant in this position. The first thing I want to do is to place an implant in a septa. Now I'm drawing exactly how the implant should go into the septa. You can see that the septa turned out to be leaf-shaped, and the implant that we could place here will be about 8 millimeters. It seems that you will only require a closed sinus lift surgery, but there is a problem. We have to place an implant only in this projection because we have also antagonist tooth, and we should be directly in this septa. The essence of the problem is that when you work with the drills, you will expand under a certain diameter of the implant. So you will constantly have the feeling that you are in a bone tissue because you will always rest against a part of the septa with a drill. However, at these moments here and here, you will not feel that what happened to you. Therefore, this drill will certainly perforate the Schneiderian membrane. So there is going to be a gap here and here. As a result, it will seem to you that you are in a bone tissue on one side because you will constantly rest against the bone tissue on the septa, and on the other side, the drill will perforate Schneiderian membrane while drilling. So you will get an unfavorable perforation here and here, and an implant may shift either medially or distally. Therefore, in this case, it's necessary to perform a lateral sinus lift. At the same time, the particular of the sinus of this sinus lift is that the one window can be made medial and one window must be made on the distal side of the septum. Why the distal side? Because it might seem that you can do it like this, but you still have to go to the distal side, and you should elevate the Schneiderian membrane in this area so that the implant does not damage the membrane during insertion. That's why here, since there are 2 lateral windows, we'll enter through them. There is no other options here. So instead of closed sinus lift, you will have to perform the lateral sinus lift. This is fundamentally important. There is no other way to achieve success. I think this analysis should be useful to you because you should have learned a lot from this case. And the presence of the septa on one side attracts you to place an implant in this septa, but you should always remember that when working with a drill in this septa area, you will have the deceptive impression that you are completely in the bone tissue. So that the drill will damage the Schneiderian membrane with its movement, and you will perforate it here. It will be unfavorable. In such cases, you will need to have access for the lateral open sinus lift, and during the surgery, you will need to cut down this septa.